Save My Piggies, Your Life, Your Limb, Your Story, with host Dr. John Phillips and Kym McNicholas.
Hi, everyone, and welcome to the show. We have a very special The Heart of Innovation. It's our Save My Piggies episode. And before we really get into the thick of it, I have a special announcement, Dr. John Phillips.
Yay!
Since you introduced us to nurse practitioner Deidre Arms out of Ohio, you saved her life. She and I have been doing a lot of talking, and she has agreed that starting in 2024, she is going to be the Way to My Heart's Director of Wellness. Because as you know, lifestyle modifications are a really big deal. Patients have so much power to improve their prognosis with peripheral artery disease and heart disease. And so she is going to help lead the charge in 2024 to really revolutionize our program and help patients.
That is fantastic. Deidre, among other things, is a very focused young lady who I will never forget once we got her through that pretty rough patch, because I remember she saw me in the hospital or in the office a couple times, and she was anemic and not doing well, but she stayed positive. She stayed focused. Next thing you know, I'm getting texts from her. She's climbing a mountain and, well, I'm making things up, but I could see her skydiving. I could see her, scuba diving, whatever. She's one of these people that, kind of dealt with the situation, and instead of kind of going towards the dark end of the thing, she gravitated towards the light and was positive and took what we said to heart and mind and changed her life. And I think she's going to be a great addition to the team. So congrats.
Thank you. I'm super excited about it, and looking forward to just talking to other people and helping other people on this journey as well, because that's what I think we need: a community. We need to support everybody else as well. But I have something kind of special for you, Dr. Phillips. So not only did you save my life, but through this entire process, and this last, we did a podcast together, and I sent it to all my family, really excited about it. And well, my sister has a little story to tell you. She's on here tonight. And
your sister?
Yeah, I do. Yeah.
All right, cool.
Dr. Phillips, do you recognize Ange?
I can't see the, hold on. I'm having a hard.
In case everyone's wondering, we also have it. We're broadcasting via Zoom to 8:60 a.m. The Answer on the radio, so we can see each other. You just can't see us. Not everyone can see us.
Oh my gosh!
Welcome. Hi, Dr. Phillips.
How are you?
I'm great. How are you?
I'm doing well. Welcome.
So, Ange, how did you get introduced to Dr. Phillips? Look, he's great. He's turning red.
I am turning red.
I had vascular disease for about 4 or 5 years, and I have been seeing a totally different doctor who done 2 surgeries on my leg. And then he said to me, there's nothing wrong with you. It's just arthritis. You need to see your primary care. And he wouldn't do anything for me. And I switched doctors, and I got paired up with Dr. Kalori, and then Dr. Phillips does his surgeries, and he done the one and only surgery I've had to have since then. And he scraped my, my groin artery out, and he done that surgery, and I haven't had to have surgery since. I'm walking, I've lost weight, I'm living my best life at this point, and I totally owe that all to Dr. Phillips. And when I heard that podcast, I was like, oh my gosh, Deidre, that's my vascular doctor. I had no idea that was your cardiologist.
That's awesome. Yeah, it's, I don't know what to say. So I'm glad you're doing well, and I'm glad the two of you are doing well. And it's fantastic.
What are the chances?
I guess I didn't put 2 and 2 together, and nor did you either. But yeah, life is small. It's a small world out there. So I'm glad you're doing well. That's right. I remember your case, because it was one of those where we had some issues, but we got her fixed up, and yeah, that's awesome. I'm glad
Yeah.
you're doing well.
I go in December. This will be year 3 of my scans that hopefully we have no problems. So I'm looking forward to a good bill of health and to move on from there. So I definitely owe that to you, and I can walk anywhere I want at this point, and I just have never felt better.
Fantastic.
I mean, I
Fantastic.
think it's amazing that here you have Deidre and you saved, I mean, these are 2 sisters. You saved Deidre's life and her sister Angie's limb. I mean, that's incredible. And when
That's
they
full
told me
circle.
about it, I was like, how do we pull this off? How do we surprise Dr. Phillips in his own Save My Piggies episode?
I'll
And
tell you
he's
one
the
thing.
one who did it. You're the one who saved the piggies.
No, I know, but I don't like surprises. You can tell I'm a little uncomfortable. My wife threw me a 40th surprise party a while ago, and I didn't like it. So, but all right, I'm gonna and let's talk. Let's talk. I'm again. Hey, listen, I'll tell you this though. Today I had to give a talk to our some of our cath lab staff, which you guys have met, and it was on peripheral arterial disease. We talked about it, and I titled it "Peripheral Arterial Disease." And I said why. I said why with a question mark, because a lot of times the staff kind of looks at me and some of us that do some of the work, mainly in the legs and the patients that have critical limb ischemia, like, why are you doing this? Why are you spending all this time and effort when you know it's going to close up again, or the patient's not going to be compliant, or you're just rearranging chairs in the deck chairs on the Titanic. And I say, because there are and I know patients, I have patients that have done well, and they are the inspiration to keep moving, keep on moving. Yesterday, for example, I had a gentleman that he was told he needed a major amputation. I said, let me see if I can help you out. We almost, Kym, you've heard me say this sometimes, or when I talk to other folks, like, I'm the definition of insanity is kind of doing the same thing over and over and expecting a different result. And so I was down to my last bag, the last thing in my bag of tricks, and it just happened to work, right? So we get blood flow, and I tell the patient's wife, and she basically started crying, and she was so happy. And I told that story to my staff, because I'm like, listen, this is why we do those things. This is why you all work with us to kind of get this job done. And the quote actually is, well, my inspirational quote to them today was, the war was not won by generals alone. And so, we're all in battle together. We all work together, pull the rope in the same direction to help people. And so I'm super tickled that you guys are both on the show, but I'm gonna have to have Kym do most of the question asking, because I just gotta get my wits about me here.
Well, we're going to give you a moment to get everything, to take this all in, and we're going to head to break. And we'll be right back with Deidre and Ange. So stay with us right here on the Heart of Innovation's special Save My Piggies episode. Welcome back, everyone, to this special Save My Piggies episode of the Heart of Innovation. In our first segment, we had the opportunity to surprise Dr. Phillips, who created this Save My Piggies idea and the entire show around it and the series. And it's not often that we actually, I don't know if we've ever, had you do a Save My Piggies and one of the piggies that you saved. So, except we did do a special with Deidre, right? You saved her life. She was on the verge of a heart attack, and you ended up revascularizing her heart and saving her life, getting her back on her feet. But we haven't, I don't think, done an episode where you've saved their legs, but yet every week, every other week, you're either on call and you're like, oh my gosh, I got to run out. I got to go save some piggies. Or just a few weeks ago, we were waiting and waiting and waiting. You had an emergent case and you never even made it to the show. So first priority is always saving those piggies. So it was really interesting when I was having the conversation with Deidre. I was just tickled pink that she came to me to tell me first that you saved her sister's legs. And I thought, you're the one who introduced me to Deidre. And I thought, yay, she came to me first to tell me this tip.
Well, so I guess let me just say this, Kym, because the Save My Piggies kind of idea, yes, that was my idea, but you have kind of helped usher it into the 21st century and actually got the ball kind of rolling to have these episodes, because your network is much greater than mine. And yes, to your point, I think we've had a couple of guests that are mine, but the vast majority are yours. And so I have to thank you for the partnership that we have, working together to create not only the Save My Piggies, but the Heart of Innovation. And in fact, I did do a shameless plug with my during my talk with my staff today with your background, the background of the Heart of Innovation, the Save My Piggies. So everybody knows what Save My Piggies is around here. And now I think they understand why I do what I do, or we do what we do, because I shared with them some of the sobering statistics of high mortality rate in this patient population and an amputation rate. And if you have an amputation, what that means. So I think everybody's a little bit more understanding of some of the complexity of the cases and understand why we do what we do. But these two sisters, I think it's amazing that both of them have been able to be helped within the medical system, not necessarily just by me, but the fact that you guys kind of sought out, like Deidre, for example. I referred you to Dr. I mean, we got you kind of stabilized, and then Dr. Blossom did the bypass, and that kind of moved things forward for you. And then Ange, obviously, you had Dr. Clear, my partner, and he kind of referred you into me. And so we all work together as a team. So I'm tickled pink, but I'm glad you guys are doing well. That's all.
The one thing that stands out about you, Dr. Phillips, is you listen to the patient, and that's a lot for a woman in her 40s. And we both were when you met us. We're both in our 40s, and you did listen, and we no longer feel helpless because of that. It's empowering as a patient to have a provider who listens.
Well, I would just say that we all need to be more empathetic. And I've had some guests on our show that have, kind of called me out about certain things. Because for example, I'm running really behind today in cases. And sometimes we don't think about, like, when we say we're just going to cancel a case, and for us, it's kind of like whatever, but for the patient, that's a big deal. And we try to be more empathetic.
And that's really hard, but it's really interesting because both of you are in your 40s. And I have so many patients coming to me on a weekly basis that always say, my doctor says I'm too young to have PAD. And so they don't listen. They do brush it off. And you said that you were brushed off with textbook symptoms, right? And they said it's just arthritis. Did they even do any sort of evaluation on you? Can you walk us through that journey of when you first started experiencing symptoms of PAD, and what doctors that you went to that continued to brush you off?
So I had been to several doctors to complain about it for probably up to 10 years before anyone figured out what was going on with me. And then I actually had a heart attack when I was 40. And then I kind of got referred from the cardiologist I was seeing at that time. They said, oh, that sounds like vascular disease. So they referred me to the doctor down the hall. And I went in and I done tests, and they immediately admitted me for my first surgery. So he had put a balloon behind like where my knee bend is, to open that up, because I had like a 96% blockage in my leg. It was very serious. So they done that first emergency surgery, and within, I'm going to say 3 months, I couldn't walk again. And I was trying to walk on the treadmill every day, and we were going for walks at night, and I could barely make it like to the stop sign at the end of our street in our little neighborhood. It was just crazy, and I could barely walk from my car into work. It was super debilitating. And then we got scheduled for a second surgery, and they did some stents in the bottom of my leg. And then it was probably 3 months later, I went back to him and I said, this is still terrible. And he just treated me like I was crazy. I didn't know my own body. And he was like, there's no way that's not working. You're just feeling arthritis pain. And then I said, I'm not doing this. And I talked to Deidre about it, and we just decided, let's get a second opinion and let's move on from that. and I called Dr. Calori's office and I explained my situation, and they were like, yep, we're going to see you. And then they did the test like within a week, and probably within a week or so later, I was in with Dr. Phillips having surgery.
And this is something that we talk about in our network, with patients all the time. Different doctors, different approaches, different tools, different techniques. And I've traveled around the world to nearly a dozen countries, more than 30 states, watching hundreds of doctors perform thousands of hours of procedures. And what was most disconcerting to me was, the different outcomes that would occur based on the different tools and the different techniques, the different skill sets that these doctors would have. And so, for example, in your case, you talked about a balloon behind your knee. That's the popliteal artery that's behind your knee. It's a very sensitive spot. You bend there. It's really easy for it to reocclude because it's just that bendy area, lots of tension there. And some doctors I would watch would go into the arteries, and they would try to go 0 to hero in unblocking those arteries. And so they would go in with a balloon. And so it's called balloon angioplasty. And so they would dilate or blow up a balloon, inflate a balloon. And some of them would just pump it up as hard and as fast as possible and just pump, 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 pump. And I'm like, oh no, it's going to blow. And they end up perforating or dissecting the arteries. So they have to put a stent in. And that's just going to trigger a very quick healing response. They do the same thing, across the leg, however. Now, a doctor like Dr. Phillips, who is more advanced trained in some of the newer techniques, is that he tiptoes into the vessel and he'll barely kiss it with the balloon, just blowing up the balloon just ever so slightly and slowly. So the plaque just slowly is pushed to the side, trying to reduce or mitigate the risk of trauma, or you try to reduce the trauma, right? And so usually we find, for example, in your case, that in doing so, using less traumatic techniques inside the arteries, it was more durable for you, right?
Right.
You were able to, I'm curious, you were able to, get out probably within hours and go out and walk.
Yes, I was home probably 3 hours after the surgery. And I think that evening we took a walk, and Dr. Phillips followed up with me. He called me that evening to check on how it was doing. I was able to walk up. I live in a split level house, so you have stairs going anywhere you need to go. So I was able to walk those with comfort. And then the next day, it was like I had never had an issue with my leg. So it was like immediately I had relief, and I haven't had an issue with it since. And I had been going and having to have surgery or something done with my leg every 3 to 6 months, and nobody listening. And like Deidre had said, the day of surgery, Dr. Phillips came in and talked to my husband and I, and there was a delay because there was an emergency, and he explained all that, and he listened to our concerns, and it just was so smooth and so much better. And I just felt so helpless. And then all of a sudden it was like, okay, this person's going to listen and actually care about how I feel, and how much better this is going to make my life.
And coming up right here on the Heart of Innovation, our Save My Piggy special, we'll have more with Ange and Deidre, as well as Dr. Phillips, so stay with us. Hi, everyone. Welcome back to the show. Before the break, we were talking about Ange's limb-saving procedure that Dr. Phillips actually performed, and the difference between some doctors who tried to go 0 to hero, pumping up those balloons to open up those arteries, triggering that inflammatory response very quickly. It doesn't last very long. Dr. Phillips comes in, he really tiptoes in. Less is more is really the approach, because Dr. Phillips, the whole idea with these procedures is just to give a patient that much more flow so that they have that much relief so they can get out and walk to be able to grow their collateral network of vessels, correct?
Yeah, I mean, everybody has different disease, and my job is to kind of assess it, figure out what's going on, where the blockages are, where they aren't, what's the best way to treat it. And oftentimes, I was just sharing with our staff this morning, about 50% of people with PAD don't have any symptoms, and those that do, we try to manage them medically. And if not, then we proceed with procedure, whether it's endovascular or surgical. But at the end of the day, you have to do what's in the best interest of the patient. And I like to kind of minimize the approach.
Yep.
And you can always, it's like adding salt on your food. You can always add more salt, but you can't take it off. So,
Yep.
you know,
Good
if
analogy.
if we need to do some more work, we will. If we can, you know, get away with being minimally invasive and less, and not leave stent or whatever, I try to do that as well. So I'm glad
And
it
right
works,
now,
and every once in a while we get it right.
but you have to go save some more piggies. So we're going to continue the conversation. And Deidre, any final things to share with Dr. Phillips before he runs and saves some more piggies?
Well, because of you, we get to have holidays together. So thank you.
No,
Yep,
you're-
just blessed to have met you for sure.
you guys, I'm humbled. Again, it's a team effort, and I appreciate everything that Kym has done for the Save My Piggies kind of movement. And we look forward to help more people, and look forward to seeing you guys again. So again, sorry I've got to run, but good seeing you, and have a great Thanksgiving.
And thank you for jumping in between cases. We really appreciate it. I know it's getting late there, so this is awesome. And we'll
See
get
you
back
guys.
to, I mean, it's just amazing, you know, how empathetic, you know, he is. And you were mentioning it earlier in the episode, and what really drew you to him and keeps you coming back to a doctor like Dr. Phillips is the fact that he is someone who listens. He is empathetic. Was there any, you know, moment during your conversations with him that was really that turning point where you said, oh my gosh, I can't believe that I'm sitting here with him, and he's either spending so much time, or he just answered this question for me?
Well, I just felt like he had taken time out from, like, he was having some emergency surgeries and he was doing this and took the time out to come and speak to us and make sure all of our questions were answered and that we felt comfortable waiting and proceeding. And he even said, do we want to postpone this? Like, I got time to do it if you guys have time to just wait it out. And he just was so patient and kind and spent his time. And for me, that meant a world of difference from what I had had with the other doctor that I had been seeing. It was just so marvelous to me to have somebody that wanted me to feel comfortable and do whatever he could to make me comfortable.
It's interesting because we've had several folks in our network who have said that they're very frustrated with even clinic appointments where the doctor will come in, they'll be 30 minutes late, and they'll start the process of evaluating them, and then suddenly they barely have 5 minutes with them. Then the doctor's gone for 10 minutes out on a phone call, and then they come back and write things up, say, these are the things you're going to do, and leave. And you're sitting there and it's like a whirlwind. Like, what just happened here? Why did he even come here? And you're left with literally no hope. And it sounds like before you found these two doctors, that's really what you were feeling like as well.
Yeah, definitely. And I actually work in the medical world, so I
Oh,
understand
you
how.
do as well.
Yeah, I do medical billing. So
Wow.
I worked in a physician's office for many years. So I understand how busy it gets and that doctors kind of have to do that to be able to see the amount of patients that need their care.
Right.
So I'm not so much put off by the fact that they can only spend so many minutes, because I understand there's patients that have other problems more priority than mine. But at the same time, I feel like he definitely wanted to get to the bottom of what was going on, and he cared about what was going on with me, where I don't feel like that was the case with the other doctor.
It takes that one moment where they just can be human, and they can ask you and say, hey, you know what, and be honest with you about what's going on, right? Hey, I have all of these other things going on. I really want to get to the heart of what's going on with you. I want to give you the time that you deserve and the quality of care you deserve. But this is really what's happening. How should we move forward? And I think that that type of approach is what really seemed to make the difference for you.
Definitely.
We did have a doctor, doctor in Louisiana, who is his waiting room is always full. I mean, at least, 30 to 40 patients. I mean, it's always full. He's always behind. But what he does is he comes out every once in a while and he makes an announcement to the waiting room and says, "Hey, everyone, I just appreciate every single one of you for being here. I appreciate your time. I know that this must be a strain on you, waiting here. But I hope you understand is I'm trying to give each and every person who comes into my office the quality time that they deserve. And I'm going to do the same for you. I'm sorry that I'm running late." And that goes such a long way, right?
Everyone just wants to be heard and they want to feel like their doctor cares about them. So that does go a very long way with most people.
Mhm. And I'm sure, Deidre, you've never been delayed as a nurse practitioner. Everything is always on schedule, right?
Just right on time, all the time. So every minute. Yeah. There are things that happen in the day that you just have no control over,
Oh,
especially when you're dealing with patients.
and you
So
always want to make sure that the one that's right in front of you in that moment gets the attention and time and care that you can give in that moment, right?
you do, you want to make every moment count. Like
Yeah.
sometimes you have a few 2 minutes, an extra just eye contact, just listening and hearing what they have to say. It makes all the difference. And it also will make a difference in your clinical decision making as a provider. Like, when you hear that extra thing they have to say. I one time read something about, when you're female and you're feeling tired, and it's easy for providers to let that go because they're thinking of the more emergent things, but they sometimes don't hear like how tired and how it's affecting you to like make that click. Like if they know enough about your life to know that that is really a problem, um, then it is of value to their clinical decision making.
Oh, that is such a great point. And coming up right here on the Heart of Innovation, I want to dig into that a little bit more because I know a lot of other women especially have that issue. So stay with us right here on the Heart of Innovation in this special Save My Piggy series. Hi, everyone. Welcome back to the show. Before the break, Deidre was mentioning a really good point, especially when it comes to women and the reason why it's so critical that physicians do take a little extra time to get to know the patient, to really understand that, the symptoms that they're experiencing really are an issue and they shouldn't be brushed off no matter how old they are, especially like in your case, Deidre and Ange with a significant family history, right?
Exactly. I think with our family history, you know, we had an aunt at age 50, a mother who died of a stroke, a 32-year-old cousin who had had a stroke, and then Ange is the youngest of me and my sisters, and she had her first heart attack at 40. And I remember her calling me and explaining to me, and I was like shaking, just like I knew what was happening. And I was like, you got to get to the hospital, take an aspirin right now. Like, and her husband was doing things, and I was like driving rapidly to get there. And when I got there, they're like walking me down the hall, and I'm seeing we're going to the cath lab, and I'm like, oh my gosh, don't let this happen again. Like, I had seen it many times. Our grandfather died at 52 years old during open heart. So it's just really young. And when you have a male in the family that's really young, like that has this going on, and cardiovascular disease just kind of peppered all through the family. Um, that's really important to listen to those people's history. And so when somebody like that comes to you with fatigue of any sort, because that's what we were talking about during the break, you really want to see what their activity was. Like I had mentioned before, I could ride my bike every day 10 miles, and then all of a sudden I couldn't even go a mile without not being able to breathe. And I was like, I don't know what's going on with me. Like I know what I do right, and I know things I could improve on, and we all have areas in our health we can work on, but I knew what my activity was. And whenever you have this decline, and you're trying to express it, you feel like you're getting gaslighted by the medical community often because you're trying to explain like this such a vague symptom as fatigue or just
Right.
feeling restless, and just nobody, there's not a way to like convey that as a woman sometimes. There's not a
Well,
way.
and it may be a vague symptom to them, but it has like destroyed your whole life and you can't function properly. And they want to say things like, are you sleeping? Are you eating right? Do you need to lose weight? So then they just kind of boil it down to one thing when your whole life is affected by this one symptom that they feel is vague, but it's not to you.
Yeah, I still find that many doctors, when it comes to heart disease, especially before they'll do anything, before they'll perform an advanced test, you have to report angina, cut and dried. I mean, even some patients that have peripheral artery disease, those blocked arteries in the legs, or 3 in 5 people who suffer a heart attack have PAD. They still refuse to check, some doctors, some refuse to check the heart unless they have some sort of angina. And I'm curious, Ange, how long before you had your heart attack had you been experiencing this fatigue, and were there any other symptoms?
So, really, the vascular thing was the thing that started me, but everybody just wanted to act like it was my weight or what I was eating, like we had talked before. But I really, I had no idea anything was going on with my heart whatsoever. So that morning that I woke up and I just felt the gloom and doom. And then I got sick and I called Deidre and I said, this is what I feel like. And I just don't feel right. And like she said, she knew immediately. And she was like, you need to go to the hospital. You're having a heart attack. And I was like, oh, I am not. Like, I'm 40. Why would I be having a heart attack? And she was like, I'm serious. And my husband was like, okay, let me get a shower because we just thought whatever. And she was like, you need to call the squad right now. So we did. And that is exactly what it was. So I wasn't really experiencing any symptoms until that morning.
That you are aware of,
Right.
but that fatigue was probably real, probably evident beforehand.
Yeah, and it probably had been going on for 10 or so years, but I'm diabetic and I kind of chalked it up to that and just kind of snowballed it in with high blood pressure and overweight, and because that's what I had been told in my past.
So you have all the risk factors for it, and yet
Right.
they still did not do any sort of preventative testing just to say, hey, you are at risk for a heart attack, stroke, and even amputation with these risk factors. Uh, there was no stress test taken. There was no baseline set.
None. And especially with that much family history on file, no
Right.
one ever looked at that.
And so, were you the first one to have the heart attack, or Deidre, was it you?
I was the first one.
So you were the first one. So, Deidre, even with your sister having that heart attack, you still were being brushed off by your doctors. And you were saying, hey, doc, no, my sister had a heart attack and she's younger than me. Are you sure that's not what's going on? I mean, I was literally riding my bike these 20 miles and suddenly I can't do it at all. I'm short of breath. I'm fatigued. Still nothing.
They knew my history. And the thing was, Ange's doctor come out after that heart attack and he looked right at me and he said, if your vascular is anything like hers, you need to be checked out now. And like I knew right then, like, we're just peas in a pod. There are things in our family that some of us are strongly affected by, and through our life that's been kind of Ange and I. And so it wasn't even a year and mine happened.
And how are your legs, Deidre? Have you
Well,
had your legs checked?
I have not had my legs checked. So I'm not sure. I will tell you, I hike and walk a lot.
Mhm.
But no, I haven't had my legs checked. So that's something I probably should talk to Dr. Phillips about.
He's the perfect person. He's in there saving piggies right now. The
Yes.
one thing that we tell everyone, especially when you do have a family history, is, "Hey, doc, let's chat." And chat is an acronym for, "Hey, doc, check my carotids." C stands for carotids, H for heart. Not just, listening to heart, but also checking the valvular health of your heart, maybe performing even an ECG if possible. A is for abdomen. Have them check for a bruit, that turbulent flow in your abdomen, checking for an aneurysm. My mom transitioned a year ago. The doctor never even touched the patient. If they would have touched my mom, they would have known there was turbulent flow in her abdomen, and they might have caught that aneurysm before she passed unexpectedly, as they say. And then T for toes, checking your foot pulses, your leg pulses, especially if you're diabetic. That is incredibly important, right?
Yes.
Definitely.
Well, coming up right here on the Heart of Innovation, we'll have final thoughts from both Deidre and Ange, so stay with us. Welcome back to the Save My Piggies special episode of the Heart of Innovation. We have Deidre and her sister Ange, and I am still, honestly, I'm still a little bit, and I know we're at the end of the show here, but I'm still in shock of the fact that you both have this family history, and yet it took in each of your cases being on the verge of a heart attack for doctors to finally listen and get you in.
Exactly. And you know what's funny is if you come in with a family history of cancer, somebody's listening, right? But sometimes when you come in with this family history of cardiovascular, it just I don't know. I don't know what it is in our medical community when it comes to women, especially. And I'm speaking for myself, and I have many women that I've cared for under the age of 50 that have had heart attacks, had open heart surgery, felt like they had never been heard, been to the ER, got sent home, come back. Like we have to do better. We know better. We know this connection with family history. We know what genetics does. We know there are markers for people to have worsening vascular disease. So we have to pay attention to that. We have to do better in our medical communities. That, if I can say that like as loud as I can, like just listen and pay attention to that family history because it means a lot. And I did have stress tests. But it was a 7-minute stress test and I couldn't even like finish it. And they said, well, you had a robust thing, but why was I so short of breath? And Dr. Phillips, if he were on here, he could have told you that was 2 years prior to my heart attack. And I had collaterals because I had a blockage. I had a blockage, like a complete blockage, 100% blockage of my LAD. And I had built a collateral system myself by trying to push through things like women always do. But then I still had the dissection when I seen him because when you aren't heard, you stop pushing for it at some point. Like
It's so true. I mean, when it comes to breast cancer, when it comes to colon cancer, when it comes to prostate cancer, there's pre-screenings now. You actually, as a human, you have a right to get a screening, preventative screening, at a certain point. Why is that not the same? And if it was the same, I know it would be for PAD. It would be having an ABI test or an ankle brachial index test, right? Or a leg artery ultrasound. But what would it be for heart disease except to check your blood work, check your cholesterol, check um your what else?
yeah, and there are some genetic markers. There are some things that are coming out that they're finding
LP
genetic.
little a.
And I have that, and I'm sure Ange does too. We haven't talked about that yet. We talk about a lot, but um, so that's those are things that you have to find a provider that will dig a little bit deeper into those things. And And I did, but that was after the fact. That was retrospectively.
Right. And Ange, what are your final thoughts?
I just feel like as patients, we just have to be persistent. Like we're worth it, and you have to fight to be heard.
Yeah.
And you just have to roll it out there and be like, listen, this isn't normal. And if nobody will listen to you, you have to find someone who will.
Yeah, so many people say that, you know, their insurance is very restrictive. And so they struggle with, you know, switching from provider to provider. And especially if they're in an HMO, that it's a very close-knit system, and it's much harder, and there are a lot of politics involved to be able to go get a second opinion. I know that when I was looking for a different one, and we found out my dad had heart disease, and then my younger brother went and got scanned. He got a calcium score, and he had an echocardiogram that he paid for separately because his insurance wouldn't cover it. We found out that he had a bicuspid valve defect, he had an aneurysm, and he had heavy calcium build up. So I went to my doctor at an HMO here in California, and I said, I need to see a cardiologist. I need tested. They said, do you have angina? I said, no, but my brother just found out he could have a heart attack at any moment. I don't know if I'm at risk. And they refused. So I went to get another primary care physician. And the moment I walked in, he's like, oh, I know your story. And I said, excuse me. He said, oh, I saw your doctor out in the hall. We think you're a hypochondriac.
That's
Lo and
terrible.
behold, I have the start. I have my aortic root is dilated. I got out of that system, and I ended up finding out that so now I'm on a regular system to get checked every year. So you got to be your best advocate, right? And you have to just push for it no matter what. Fight the politics. Don't worry about what other people think. Do what you feel is right for you, right?
Absolutely. Absolutely.
Because your life, your limb are on the line. It's your life, it's your limb, it's your story.
Yes.
Thank you so much, Deidre and Ange. We really appreciate you being here.
Thank you, Kym.
Thanks for having us.